If you want a straight spine, your leg is important. When your pelvis rotates, one leg gets longer, rotating your pelvis, and your shoulders follow. This rotates your whole body, but your spine will twist back to stay in midline, causing a curved spine and uneven posture. So if you really want a straight spine, you've got to fix the root cause, and that's usually the pelvis rotation. You get that lined up first, and then the spine and shoulders will naturally follow. And honestly, the best technique I know, and I bet a lot of other physical therapists would back me up on this, is the muscle energy technique. Personal experience, it's helped my patients the most, and the results are almost instant, really effective for resetting pelvic alignment. So quickly, what exactly is the muscle energy technique? I mean, it sounds like something you hear in an anime or a game. Basically, you take your joints to its end range, the furthest it can go, let's say hip flexion, and then you activate your hip flexor muscles that will pull it even further into flexion. This will pull your joints and reset it, and boom, you get a better alignment. So this is the 3-step process I use to fix pelvic rotation. Step 1, we'll check to see if you actually have a pelvic rotation, so you know which side has which problem. Step 2, we'll go over how to correct the anterior tilt on one leg. And step 3, we'll also fix the posterior tilt on the opposite leg. By the end, you'll not only know how to spot it, but you'll also know exactly how to reset your pelvis and get your spine lined up the way it should be on your own. So step 1, supine to long sit test. Lie down on the floor with your feet relaxed and bring them together. Then check which side looks longer. Next, sit up and see if there's any change. For example, if your legs are even or your right leg looks longer while lying down, but then your right leg looks shorter when you sit up, that means your pelvis on that side is rotated forward. That also means your left side is rotated backwards in relation to your right side. But if nothing changes from lying down to sitting, then pelvic rotation might not be the problem. In that case, it could be true structural leg length difference or scoliosis. Now step 2, fixing your anterior pelvis rotation. Now that you know which side is rotated forward, let's fix it using the muscle energy technique. Let's say my right side is rotated forward. Lie down on the floor and bring your right leg up as high as you can. Turn your hips out, then open that hip to the side as far as you can. This puts your pelvis into its most posterior position. Once you can't go any further, hold that leg in place with your hands and now activate your glute muscle. That means push your legs out like you're trying to get out of that position, using about only 20% of your effort, but without moving your legs for 10 seconds. Then relax and try to pull your leg even further into the range for about 30 seconds. Now repeat that process 3 times and you should feel your pelvis coming back into a neutral position. Now to maintain the results, you will have to do this technique 2 to 3 times a week. And to have longer lasting results, it's better to supplement it with knee to chest stretch whenever you can in your daily life. You can do it on your back like this or even standing. As long as you get the reps in, it will help your pelvis alignment. Now step 3, fixing your posterior pelvis rotation. If step 2 didn't work, it might actually be your opposite leg that's rotated backwards. So let's say this time, my left side is rotated backwards. Lie on your side with your left side up, bring your left leg back as far as you can, bend your knees, and let it drop down toward the floor. While holding that stretch, activate your hip flexor muscle like you're trying to bring your knee forward, but only use about 20% of your strength so that you don't actually move. Hold that for 10 seconds. Now relax and sink deeper into the stretch for about 30 seconds and repeat that cycle 3 times. Same as before, do this technique 2 to 3 times a week, and result is the best if you supplement this one with a hip flexor stretch. You can stretch sideways like the technique or in a half kneeling position or even standing. As long as you get the reps in, it will help your pelvis alignment. Well, I hope this video helped you correct your pelvis, which is often the root cause of a curved spine. If it did help, or if there's another topic you want me to cover, drop a comment below. Thanks so much for watching, and I'll see you in the next one.